Well, first of all, thank you both very much indeed for coming to talk to us. We really appreciate it, so thank you.
Thank you so much for the invitation.
Thank you for inviting us. Yes.
So how important do you think artificial intelligence can be as a tool in psychiatry?
I think that is the beginning of a new era of technology that we need to be aware of and also to be more involved in psychiatry specifically to understand the voice of the patient outside of the setting of our offices, outside of the setting of the medical records or the claims or the system, the healthcare system. This is something that we can help us to provide more better care for the patients, understanding what is the mindset of them outside of the clinical setting.
Tell us a little bit about some of the work you've done.
Yes, so we have done work trying to understand the journey of the patient when they start having suicidal thoughts, and what are the differences between, children and adults. We have done some work with the journey of the patient when they have depression, and what are the differences between like Hispanics, African Americans, and white. What are some of the barriers to care, and what are some of the opportunities for improving our treatment?
And how have you actually conducted the study? What sort of data have you been looking at?
We partnered with a company called Culture Intel. That is a company that specializes in that, in analyze, not for mental health purposes. They analyze data, open source conversation for other purposes to see what is the opinion of people for a product or things to different settings, not in psychiatry. So what we saw, it was the opportunity to use the same set or the same data that they are using for other purposes, more for in the sense of understand the patient. So we partnered. We established a partnership with this Culture Intel company that is based in New York City, and we established a connection with them very close. We work very close with the engineers that they have the data, and we guide them about what we really need from them.
What did you find out from looking at the open data that you didn't already know from the close relationships you have within the communities?
So one of the most interesting things for me, I work with adolescents, it was that I thought most of the adolescents will go online to social media first to look for information, right? So I thought when they were going to look about depression, anxiety, suicide, they will go to the regular social media channels. And what we found is like they were more going to the message boards of the some of the organizations that actually talk about this, right? So Medscape, Epilepsy Foundation, right? And they tried to connect with other people who had the same illness. So we saw this as such as a big opportunity for psychoeducation to use some of these poster boards as a tool to engage these patients on learning more about their illness and to direct them to get the treatment that they need.
Why do you think it's important that psychiatrists are involved here?
I think that one of the important points that we have discussed is that we are the subject matter experts in psychiatry. We know exactly the criteria that we use for the diagnosis in the DSM-5. We know the treatments, we know, so if we don't get involved in this earlier in this stage, they are starting, but it's going to be more and more and more studies and projects related with artificial intelligence. If we don't get the information or we are not involved in early stage and we are not really involved with the people that they are doing the studies, we are missing a big piece, and it's the application to our patients. How you can apply this to clinical the settings.
What's the next step with your work?
I think that there are many questions that they need answers, and we see this like a channel, a bridge between the new technology with the unanswered questions that we have in psychiatry. Many possibilities. We are focusing the population that we treat. Dr. Falcone, the children, adolescents. I am more in the Hispanic community developing programs, but together I think that we have programs focus in the more use of this technology to answer other questions that we have in psychiatry.
Yes, and I think it can inform some of the studies that we do. It can inform, it can help us understand the barriers that the patients are facing. It can help us look where are the patients going for information, so we can create specific tools in those settings to educate them. I think there's so many opportunities that psychiatry can get out of learning what are the things that the patients are not saying in our offices.
Well, thank you both ever so much indeed for talking to us. It's really, really interesting, so thank you.
Thank you very much for the invitation.